All right, and with that, we'll move on to the board action under new business. The first item is the 2021-22 Health and Safety Plan. Is there a motion? Oh, I'm sorry, Dr.
Present it. Let me present it first. So we have a PowerPoint that just has some of the highlights here. John, if you can scroll to the next one. So I have a timeline up here because similar to last year, things keep changing. I want to just offer to the community as well. There will be more announcements coming from the Department of Health tomorrow. Our IU directors in the state met with the Department of Health and Department of Education this afternoon, and we received a brief from the our IU director here in Central Susquehanna, and that came out at about 5 o'clock or so. So this is how much things are evolving. Keep in mind that many school districts across the state don't go back until after Labor Day. We in this area go back earlier. So things may even change once the school year's on because they may think that they have more time than they really do. But we had our first health and safety plan that was approved July 15th. It had to be approved and submitted to the Department of Ed by the 30th of July. And it is submitted the same way that we submit our grants for the ESSER funding. The CDC then released new guidance on the 27th after we had the plan, and that was regarding masking and community transmission rates in response to the Delta variant. The PA Department of Health issued an updated PA hand, which is the health network alerts that go out to all the medical and healthcare facilities, and those are really essentially the orders from the Department of Health of what have to be followed. So that came out on the 30th for fully vaccinated people. What would their requirements be for quarantine or monitoring symptoms? And then of course, still requirements for quarantine for people unvaccinated. The administrative team met on the 27th on the 3rd to review the guidance from the 27th. So there's input from the building levels too, and we're looking at this in 2 prongs. We're looking at what is going to keep people as safe as possible, but also what can we implement without causing some of the things that have been mentioned by our community members even here tonight, and making it uncomfortable for students because of maybe what their personal choices or the family's personal choice or their ability or inability to even get vaccinated if eligible. Additional discussions have been occurring between area superintendents, other legal experts. We certainly are always hearing from our council as well as counsel from the intermediate unit who meets with all the superintendents and health and safety experts. So superintendents are in communication at least once a week, either via email or informal meetings. So we all know what each other is doing, and every community is different and they have to respond to their communities, and we respect the decisions that each make. Next slide, John. Okay. So the reason for the plan, whenever the plan says, whenever there is significant guidance or changes from the CDC, we have to at least sit down and take a look at it. And the CDC right now is only recommending masking for people K-12, and CDC is only recommending that masks are for students and staff in K-12. They could order it, they didn't order it, and that is a fact, and that's true. So that's something we have to contend with. We have to interpret their decision as well as the information we're learning currently from the Department of Health and Department of Ed is they're truly leaving this to be a local decision. There is no talk of mandates. There's no talk of anything else coming out except for the CDC guidance. So it's this board's decision and deliberation that's going to come up with what our school plan will be for the upcoming school year. And in a lot of respects, it's local control, and that's a positive thing. But in a lot of other respects, that's difficult because there are certainly many perspectives in our community, and it's going to be impossible to be able to accommodate each of those perspectives. The guidance for public schools goes beyond what's in the general public. So the general public right now, if the community transition is low or moderate, you don't have to wear a mask, even if you're vaccinated. If it changes to substantial and high, then everybody should be wearing a mask. The difference with schools, they're just saying everybody wears a mask regardless. Right now, Union County is moderate. It had been low all summer, but it's going up, and we do see the case counts going up. The district also has to balance the community's response with the safety of the students. We have to keep in mind too that in a couple of weeks, we're going to have a number of college students returning back into the community, not just our Bucknell students that are resident here and required to be vaccinated by the college, but also the other area colleges. So that's going to be a lot more traffic in the area, and parents and people helping to move in, and just our population is going to go up. So what it looks like in the summertime is going to be a little bit different in a couple of weeks. So our current plan was really to just have students who are not eligible for a vaccination because it's not approved for them at all, even emergency approval or full approval, to wear masks, because we know that they can't get it. They don't have the option or the opportunity. What we're revising the plan and recommending as the administration is that we go pre-K to 8. The reason why we're including all of middle school as opposed to just 6th grade is 1/3 of the population in the middle school right now isn't eligible to get the vaccination. It will be difficult for staff to know who is who. We had a number of students in e-school last year, so not every face is a familiar face. And we really don't want to single kids out. And that is the group and the age group where, you know, you have more just issues of bullying or concerns around that. It just makes it that everybody's in the same situation and they have to do the same thing. Fully vaccinated students in the high school would not be required to wear their masks. They certainly can if they want to, but they're not required. And they have to submit proof of their vaccination status. So we collect vaccination information on every student because we have to. That's a legal mandate, even though the COVID vaccine is not a mandated vaccine by anyone, the school entity, or yet even from the overall government. We have to keep in mind that we need to know who those students are. And again, that would be a choice. A number of our high school students have been vaccinated. We know that there's some that have not, but that is a way that we can monitor that. Community transmission, if it goes to substantial or high, then we would just follow the CDC's guidance as it is. So the flexibility is for when we have low transmission rates or moderate, but certainly to follow what CDC is recommending if we end up in the substantial or high category. So I talked a little bit about the rationale as I was going through there. One of the things I really want to point out to everybody is that we are still required to identify students who potentially have been exposed to COVID-19. The hand that I spoke of right there, that's the order we have to follow. We don't have a choice over that. So if a student is a contact of a person within the school, we report that to the Department of Health. As they're tested, eventually that information gets to the Department of Health. We make the proactive call to the parent to say, you know, your child might be a contact, you'll be getting a call from the Department of Health, but you need to come pick them up. And we did that, I don't know, 700 odd times last year between all 3 of the schools. And, you know, I can tell you it's a time consuming process. It takes people away from what they're currently doing. That's also a reason why we want to know vaccination status, because if you're vaccinated, you're not necessarily a contact unless you're having some symptoms. One of the things that has changed is what the definition of a close contact is. And for the general public, it doesn't matter. If you're vaccinated, some things change, but whether or not you're wearing your mask and you're not vaccinated doesn't change. But for schools, they're being very specific in K-12 schools that 2 children, if they're wearing their masks properly and they're within 3 to 6 feet, they would not be considered close contacts. There's a real emphasis to try and keep kids in school. Understand that a quarantine also lasts anywhere from 10 to 14 days. We can't take in a student that we know that has an order to be quarantined. So all that information shared with us, that student would just be isolated until the parent can come pick them up. We don't want this to happen. It was very disruptive last year. And when we think about half of our school age population, particularly children 11 years and younger, they need a parent to stay home with them. And the situation last year where there was so much more flexibility and remote work, all of that is going away. And that's one of our concerns too. It's the health and safety of the students, but it's also to be able to support the families as they're trying to, help the community if they're certainly healthcare workers, but also for them to get back to work and not have those disruptions and loss in pay in some cases, because people may not have that amount of time. So masking for staff and visitors, volunteers, if they can produce evidence of vaccination, then they don't have to wear a mask. We don't have to admit any visitors or volunteers into our schools. So we have the right to do that. Vaccinated staff and visitors are encouraged to wear masks when they're working with the students that would be in grades K through 8. It's, certainly we're asking the kids to do it. I'm going to do it. We're not going to ask them to do something. And I'm, pretty confident that most of our staff will go along with that. If staff, volunteers, and visitors who do not wish to reveal, we're just going to treat them like they are not vaccinated. And, we have to protect our students. We have to protect our staff. If the community transmission is substantial or high, again, we're going to go back to everybody just wearing masks and follow the CDC guidance as it is. Outdoors, we don't have to worry about it. Busing, unfortunately, that's a federal order. There is a challenge out there now about whether or not school buses are really public conveyance, because it's not like a SEPTA bus or, an Amtrak train or an airplane or something. We know who the kids are that are on the bus. We don't let people onto the bus if they're not students. So it's not necessarily public. It's operating with the public school, but you can't just get onto a bus. So if that challenge changes, then certainly we'll take a look at that. But as of right now, that's the federal order that we have to follow. So we would collect the vaccine. Every student should have a mask with them first day of school, because things can change. Things even changed just up to 5 o'clock today, and will certainly be more officially changed tomorrow as information comes out from the Department of Health and Department of Ed. We'll monitor where Union County is, stay in contact with local health and safety experts, Department of Health, to just see what's going on, what's the nature of the kind of spread that we're seeing in the community. And we'll let everybody know every Monday where we are and what may need to happen. Right now, we don't have the Delta variant as this dominant strain in this area. And that's really important to keep in mind, because that may change. I hope it doesn't. I truly don't. I hope we stay just as we are. But because it is so contagious and it's the dominant strain, and it becomes the dominant strain, we really just need to go for universal masking. I truly wish that we would have not been in this situation, because it looked so much brighter in June and July. And I think we were feeling very good about that. And it's disappointing. It's not anybody's fault, but it's where we are right now. And we know that having the kids in school and in person is the best thing. The kids did well with the masks last year. It's uncomfortable. I'm going to be the first person to burn all of my masks as soon as I can. And I'll be, very honest about that. My personal feelings about this are different than what, as a school leader, I need to do for this community and to help support the administrators and the faculty and staff so they can get down to the business of educating our students and ensuring that they have a good school year. So that is all that we have there for the presentation. The plan is also posted there, and I have nothing else to say, Mr. Fetzer.
Thanks, I jumped the gun. So I appreciate the presentation. So at this point, I would entertain a motion to approve the health and safety plan as presented.
So moved. Second.
Moved by Dr. Zimmerman, sorry, seconded by Dr. Jablonski. Any discussion?
I just had one question about students in the elementary through 8th grade who might be undergoing speech therapy or have a hearing impairment. Are there, and if those instructors or teachers are vaccinated, is there an opportunity for them to work with them in a meaningful way?
That did occur last year. We also have
The
clear masks.
Great. Great.
It's not perfect. I'll say it's a challenge, and the principals could share to that too, where Kelly, where you have the most speech and language, it was very difficult, but they've also modified only working one-to-one with the students, so that where we might have had a group of 3 and we might just have 1 now, to lessen the chances of anybody being in contact.
Great, thanks.
Jen, I just would like to say that I think your plan makes, I understand exactly what you're saying. It's clearly been given a lot of thought. I don't disagree with you that you have to find a way to implement whatever ultimately gets approved. I would just like to say that if we didn't take the burden of requiring masks, we wouldn't have that burden at all. If we let that be a parental decision. The contract tracing that can be so burdensome is a fact of life, no matter what happens. I really feel like if we let parents decide what's best for their kids, with the knowledge that we as a district are going to encourage them to do what we believe is best for them, which is to follow the guidance. I feel like it actually frees you up to do what you're trying to do anyway, which is just to educate kids. I can't get away from that.
It's hard to say, it's hard to suggest that parents shouldn't get to choose what's best for their children. Of course they should. But when we're talking about a communicable disease, it's not a question of asking that people wear red on a certain day. It has an impact, a potential health impact on other people. And then people do not have the right to make decisions about other children's health. So while people can make choices about whether or not their children mask with their family or socially, or as they go about the business of their lives, I really don't feel that liberty extends into the school building, where we have a responsibility to protect the safety of the group of people who spends time in those buildings all day long, all year.
I'm just concerned with the CDC, who is at the moment, the only utmost authority that's giving us any guidance, simply says recommended. And we're saying, we're using words stronger than that. So if the CDC is not mandating it, I have a hard time taking upon the Lewisburg Area School District to mandate it. I understand both sides. I understand all the arguments both ways. I'm in the healthcare profession. I wear a mask every day at work. Again, I'm mandated to do that still. But even the people that come in, we have to say recommended. And I can tell you how many patients will wear them, but if they're given any opportunity to take them off, they do. And they make that decision. I do agree with Corey that if we leave it up to the parents and their healthcare professional, then they can hopefully make the best decision for their children, their family. And something that I had not thought about that was brought to my attention through emails, again, looking out for this health and safety, the things of vaxxed versus unvaxxed, and hadn't thought of that, you know. Kids can be horrible, kids can be mean. So if one person has a mask on and one person doesn't, then, you know, it's starting to point fingers. So even from our last meeting, I'm kind of maybe even changing my mind and retracting what I supported even last meeting. I guess if the CDC can, so can I, right? But I think strongly recommended something along those lines rather than mandated. I'm not trying to be on anyone's bus of what the other IU schools are doing. I want to do what's best for our school. But I think, you know, when you read the CDC's, it's recommended right now. So you know, semantics, I know, but that's where I have a little bit of issue of even this revised plan. So
I'd like to add to what Virginia shared is we're responsible for the entire population of the school, as well as the impact it has in the community. It is no joke that if a kid is out for 10 to 14 days and that parent has to stay home, that really does impact workplaces, right? So there's the issue of employment and employers. There's the issue of children being contacts. The experiment has been done, right? The experiment of having children unmasked in schools has been done for us all over the country, and the outcomes have not been good. 201, right? You cannot point me to a district that has allowed an entirely unmasked population, a school district, that has not had significant cases as soon as kids were back in the buildings.
I'm not saying unmasked. I'm saying that we do the same recommendation that the CDC does.
There's no place that is restricting people's ability to wear masks, right? So everyone can read the CDC guidance. Everyone knows it's saying it really is a good idea for all students, faculty, and staff to be masked indoors universally. And so there are certainly, I'm sure, staff and children who are masked in the places that are having these very high case counts, right? And I want to bring back the point, like the benefits we saw of kids not out for the flu, right? Because the flu mimics so closely COVID. So no matter what, you're going to have a kid, even if they just get the flu, out for a few days waiting for a negative test. Last year went really, really well, right? We were in school for elementary age 90% of the time and over 85% of the time for secondary.
Against recommendations, I might add, we were in school. They didn't want us to be in school.
I support the health and safety plan as written.
I think there's a lot of moving parts here and a lot of complications. As Corey just mentioned, and I have it on my notes, we were here, very similar situation last year with the Department of Health recommending that we did not open in person, and we did. And despite many parents having the right to choose to pull their students out, many did because of that decision, and many of those same parents are now applauding us for our efforts last year. So the recommendation from the state last year, although I appreciated it, we talked to our local experts, they were comfortable with us opening. We went against that recommendation last year. So I think it is wise for us to really consider what is best for our community. With that being said, I also see the challenges that many contacts, if you have an exposure with an unmasked student, what that does to families. Probably one of the biggest conversations I've had over the past year is what it's done to families, what it's done to employers with having parents having to call off or take time off to do that. So, I mean, unfortunately, I see flaws with every option that we have. I really do. So, this is, like I said, there's a lot of moving parts to this. And, if it were not for the contact tracing and the quarantining, I might have a different view. But there's definitely, again, unfortunately, there's issues and complications with all of these plans that we have in front of us.
I agree. I don't think there's a middle ground that appeases even half of the opinions that are out there. There really isn't. All I would say is that in the time that I've been on the board, I can think of a dozen different times where I've listened to one of those people talk about some aspect of something that was happening in school and how the kids rose to the occasion to do the responsible thing and to do the right thing, whether they had to or not. I think as a district, if we educate them on what we believe the responsible thing is, I really believe the vast majority of them will rise to that occasion. There are going to be some that won't, but those that won't aren't going to, even if we put in place a universal masking policy. We all know that.
I think the
What
best
does
way
that
to encourage them to do the right thing and rise to the occasion is to do the right thing and rise to the occasion ourselves. I think an interesting way to think about the CDC recommendation is to whom are they recommending? We keep treating it like they're making that recommendation to individuals, and every individual gets to do what they want with that recommendation. But the CDC is also making a recommendation to bodies, to institutions, to a board such as ourselves. And what we do with that recommendation is decide, okay, we're going to follow this recommendation. right? As one of the people who spoke here tonight said, right, it is really complicated. There are a lot of moving parts. We have to make a decision. We should make the decision that keeps people safe, right? We can make a decision that might get a lot of people sick, or we can make the decision that will keep people healthier. And that is us taking the CDC's recommendation and passing it on to our children instead of expecting them to somehow be the better people. Not that they wouldn't be. I have great faith in our children, but I think this responsibility lies with us.
I think expecting kids to take the responsibility and rise to the occasion when it's a global health issue isn't reasonable.
I
And,
think what
and giving them and saying, okay, this is what we've decided, and it's the thing that is most likely to keep the most people safe and healthy. And that to me is that's what really is at the end of the day, what makes me say that I'm going to support this plan that our administrators have thought long and hard about, have looked at, have talked through, have heard from the community, have read all the emails, have had phone calls. I think we're all trying to do that and to take all those things into consideration. But this is what would keep everyone the safest. And this is what will keep Ms. Reber and Ms. Moser and everyone else off the phones when they should, making contact tracing calls for hours and hours when they should be in the classrooms, walking around, seeing how things are going and doing the jobs that they do. I don't even know how many hours that took you last year. And I'm not saying that it's because it's an administrative pain in the neck. Like, I'm really not. It's not just that. It's all those people that are impacted on the home front by it as well. The employers that, and how many people now are like, yeah, no more COVID time. The people that even had COVID time. No more COVID time. You just need to take vacation or paid time or unpaid time off. Everybody can't afford to do that.
Isn't that something that every family puts into their own equation? I mean, if they're sitting at home and that's the calculus, I can't afford to be sick or be off work, then maybe I should encourage my child to go to school and wear a mask. It's every family's decision, in my opinion. And you know what? I don't expect kids to come to school and just automatically do the right thing. I expect them to come basically espousing whatever they hear at home. And at some point in the process, they begin to have their own ideas, and maybe it agrees with their parents and maybe it doesn't. But I really feel like every family has the right to make that decision for themselves. I can't get around that. It's not that I disagree with you. If I thought there was honestly one clear definitive expert out there that could really come give us straight facts, I'd be 100% in line with getting behind that. But for every expert that you see or read or hear that has one set of facts, there's another expert with just as many initials after his name who has a different set of the facts. I don't know how to decide.
COVID health isn't the only issue regarding the health of the whole person. It's the current issue, the biggest that we're dealing with right now. But mental health, educational health, that's why we're all here, for the whole person. If the only objective is to make sure that the kids are not exposed to or experience fallout from COVID, then we should all be in tiny closets, DoorDash with hazmat. So there's some balance, some spectrum somewhere where we're educating children, keeping them healthy mentally, in the community, with friends, sense of normalcy, preparing them for the future. And then also there's COVID prevention. So there's some harmony somewhere that in the objective of preventing COVID transmission, we're also still educating and preparing children with adequate mental health resources to continue living their lives. In the plan, deferring to the CDC for the language of recommendation is it's way above my pay grade, so I would defer to them. If that's what the language is that they use, I don't see why, because they have access to all this information also, and that's still the language they use. In the plan, the segregation of students, the isolation of students based on vaccination status seems like a pot boiling over with problems beyond whether you choose not to get vaccinated, or because of a health issue, you cannot get vaccinated, to find yourself isolated and castigated by a community because our plan says we have to segregate you. I can't even imagine the enforcement, what that would do to a child. So that part of the revised health and safety plan, I'm staunchly opposed to. The masking guidance, I would simply defer to the CDC and say that they've got bigger brains than I do on this issue.
In the model where everyone does the right thing, even vaccinated high school students will wear masks. If that's the logic. Also, I would want to point out in the
I
in
would
a situation,
expect that they would. I would be shocked in this community, knowing the diverse opinions that exist, that there wouldn't be vaccinated high school students that show up wearing masks.
right, so I totally understand that. And I think multiple people spoke to the concern of having masked and unmasked students and having to, sort of out yourself as unvaccinated if you're wearing a mask. But I think there'll be plenty of masked vaccinated high school students. So that's less of a concern. More of a concern to me is in the equation that you brought up, Corey, where every family makes the decision for their own child. You're a contact, even if you're masked, if the other child is not.
Right, I understand.
So it doesn't solve the contact problem, which is probably one of the.
It doesn't solve the contact problem, but if we make that known to parents and to kids, and for the younger kids, obviously we have to make it known to the parents. It's much less likely that your kid gets identified as a contact if he chooses to wear a mask, or if you tell him to wear a mask. Again, it goes into the calculus. They can make the decision, hopefully.
But they're then making that decision for the other child.
No, they're not. They're making the decision for their child. The other child can wear his mask. And it provides whatever protection a mask provides.
What if that child can't mask? Like, what if the child who has the health issue, who the only socialization they get is in a school, but because someone doesn't want to put a piece of cloth on their face?
They could use the clear mask then.
No, this is I'm sorry, Mary, I'm not articulating clearly. What about the child who cannot get vaccinated? You're right, I did say it wrong. So the child who can't get vaccinated is wearing the mask, but is potentially in contact with somebody who, because they're not masking, because especially at the elementary level, I mean, let's talk about social distancing. Like, that's just, and this is a thing that was going to allow us to not worry about that. If everybody's masked, then we don't have to worry about kindergartners climbing on top of each other quite as much as we had to last year. Because right now we're not going to be able to do the social distancing if everybody's back.
I also want to mention, let's talk about the positives we brought up last year, right? You don't have to mask outdoors. We have done so much to make it welcoming and make outdoor spaces, to get kids outside. Last year it was mask breaks. Now it'll just be, you go outside, right? You can have recess unmasked. You can have outdoor gym classes unmasked. There won't be masking when they're lining up to come in. Like, I just think there's a lot of opportunity there until it gets very cold, and you're not going outside as much. Like, let's just take advantage of that the same way we talked about last year. And kids loved it, right? You cannot deny that kids liked going outside more. Where those kids, they don't exist, right? There weren't kids that were like, oh, I don't want to go outside. That's no fun. So I think the no masking outdoors is a really great incentive to get kids outdoors more. Whereas last year you had to be outside and 6 feet away from each other. So we had spray painted X's all over the blacktop to make sure that, like, that's no way to play as a child.
Any other discussion?
I guess, John, I have a question. What was the administration team and the staff's viewpoint on that safety plan, health and safety plan proposing?
So, I mean, they're all here. I don't want to put any one of them on the spot or anything, but, we really kind of felt like this is the better of two really bad decisions to have to make to propose, because we really don't want the kids to wear masks. We don't want to wear the mask. I mean, we feel just as everybody else does, but we're concerned just about how to police it in the school. If there's parent choice, and if there's a parent that's maybe not making the choice that makes other parents comfortable, we're going to have teachers getting requests for children not to sit next to other children that don't wear masks, be in groups with a lot of management. I'm very nervous about that turning into a lot of just pitting teachers against the community against itself. We wanted to be able to give leeway to the high school students because a good number of them are masked or vaccinated, and they probably will mask anyway too, just out of, caution. And honestly, to just for the camaraderie of whatever reason you're not vaccinated, it's like, we're not going to have you standing out there, not feeling like you're part of the school community and the team. We have really, really good kids here. We have really good families here. So those were some of the considerations that we had when we were looking at this. I'd also add that, again, this isn't all out there yet, but we may even need to touch it later on again too, because I don't know that it will be mandatory, but opportunity for testing, pool testing or other kinds of COVID testing. But what still does exist is the Department of Health's ability to shut the school down for up to 14 days because of an outbreak. So that's what we're really kind of up against. Like, they won't, and it's very frustrating because they won't use the strong enough language that everybody can just say, okay, it's out of our hands. That's what we have to do. But they back end other things that the school will be required to do that make it really tough to have anything less than everybody masked, quite honestly. But we're trying to be flexible with staff who have certainly gotten vaccinated, as well as the students who are eligible that have as well too. So, those are other things that are still going to be coming up. Quarantining, we don't have a choice. We really don't. The Department of Health will let us know if your child tests positive. And if they have symptoms, we're going to send them home. We don't have a choice, and we have to report that. Our school nurses, we're not going to jeopardize their licensure. And I would never ask them to do that.
All right, any other discussion? Hearing none. I mean, we can, again, as Jen said, I didn't want to call anybody out, but I mean, you guys are welcome to, I mean, if you want to, again, don't feel obligated, but I mean, Jen spoke on behalf of you guys, but I mean, if anybody would like to contribute anything to answer Mrs. Browse's question. So, I mean, if anybody has anything to say in addition to what Jen said. So I'm not trying to exclude you guys, but.
I would say I don't disagree with Dr. Polinchak's logic with the plan that she put together. I don't know that I would find any students who would just say, yes, we are wearing masks because they're so much fun, and it will not be that way. But kids at the middle school age and younger sometimes need a push in the right direction. And sometimes you just have to say, this is the way we're going to do it. And when we say that, that's when they rise to that occasion. That's when they keep their classmates safe. And that's when we can keep school open as long as we can. And I was shocked when after getting into the spring last year, when I looked at the data and saw that we were one of maybe 20% of school districts in Pennsylvania that were able to be open in person day to day. Absolutely shocked, because it just seemed normal that we were doing it. Our kids were taking the mitigation steps necessary. They were following along, and the teachers were as well. And whatever that takes from the board to ensure that we'll be able to do that again this year. Again, no guarantees that we would, because who knows, but to take those steps that we think will lead us down that path again, I'm all in favor of it.
I would just like to add with that. First of all, I understand some of the concerns that are out there. Well, it is just create a segregation type, of a situation, but we have had some experiences, particularly band camp the other week, where nobody batted an eye if one person was wearing a mask and somebody wasn't. And the second part I would say too, regarding the quarantine, that was something that really affected the high school kids last year. It affected them academically. It affected them when they found out that, whether it was their sport team or, because of tests that were coming up, and our teachers did a fantastic job of learning a learning management system last year and having those materials available to them, but it certainly did not replicate in person with a teacher. I think that we will see a very large portion of our high school students, when they recognize what the masking protocol is at high school, of, if you're not wearing a mask and you're close contact, you're quarantined. That was not fun for high school. I mean, they would look at Eric and I like they'd see us coming, and that instead of being like, hey, it's Ms. Reavers, Mr. Wetzel, it's like, oh, you guys, so, again, it's not as much as we would like it to be a very black and white, CDC to say, yes, you must do this, or no, you mustn't. We have to do the best with the information that we have and what we know affects, our students.
Thank you.
No, I'll just.
Oh,
say
I'm sorry.
That's okay. Just from the elementary perspective, I just think about a few things. One is that, my children don't have an option to get vaccinated. There's not one available for them now. So, for them, it's not an option. And we do have students within our school with great, health issues that, exposure can really, hurt them. And I worry about them. But the biggest thing from last year was my kids were amazing with wearing the mask. I just didn't have, the only kids who had trouble were, it was a student who can't sit still and he's always pulling on his mask. It was not defiance. It wasn't anything like that. They were fine. The biggest argument was, which color mask can I get from, because they don't have their favorite color. But because they had to be separated, and the guidance on, like, if you wear a mask and the distance between you, like, I want my kids to be able to sit and have their desks together. I want them to be able to be on the floor with their teacher, doing the things they couldn't do last year. And if we don't have that to help keep them safe, and it may increase the potential for more contact tracing with more people, I worry about that when there isn't a vaccine option for those kids. So those are my concerns at my level.
All right, board, any other discussion? All right. Hearing none, Paula, can we have a roll call vote, please?
Dr. Jablonski,
Yes.
Mr. Rowe,
No.
Ms. Stanton,
Yes.
Dr. Unsicker Fisera,
No.
Dr. Zimmerman,
Yes.
Mrs. Browse,
No.
Mrs. Clark,
No.
Mr. Fetzer,
Yes.
Mr. Heath,
No.
motion denied.
All right, so at this point, the health and safety plan that was approved in the July meeting still stands. We will move on then to the 2021-22 parent-student handbooks.
So we made a change with our parent-student handbooks. There are now websites. There are links to each of the handbooks that are there. They have two sections. The first section is the school policies or school district policies and procedures. They're the same across each of the 4 schools. I would also share that in each of the schools handbooks, they're certainly providing guidance and what the expectations are at each school level. And they may reference some of those policies as they may impact that population of students a little bit more.
Is there a motion to approve?
So move. Second.
Moved by, so Mrs. Clark, I had a second by Mrs. Browse. Any discussion? Hearing none. Paula, can I have a roll call vote, please?
Mr. Bell,
Okay.
Jordan, before we go on, I just wanted to ask Jen, because the modification to the health and safety plan, part of what you told us was that you didn't think the existing plan was necessarily workable or enforceable. I'm prepared to make a motion to amend that further, but if you would prefer to have come back and have the admin make another recommendation, I'm perfectly happy to let you do that. Realizing that school starts next week, but
I mean, we're going to have to do something. So, I mean, and just very quickly and just communication and stuff like that.
I'm perfectly happy to
If
make them.
there's an amendment that the board would want to consider.
Well, then I'll make a motion that masking become voluntary instead of mandatory for all age groups.
For the, okay, so
And so
we're-
it basically
bringing
removing the
back the
enforcement
six-
requirement.
we're bringing back the July 15th plan that had required masking pre-K through 6. Now, all students 11 years of age and
Right.
under, and change that to voluntary, strongly recommended. Which way do we want to go?
Yeah, absolutely. Strongly recommended. Just like,
The CDC recommendation, to follow the CDC's recommendation.
It feels irresponsible to try to hammer this out right now.
Also,
Yeah.
that makes it worse. Or I would, if the alternative is everyone is voluntary, the July 15th plan is
Don't
better.
vote for the amendment. Fail.
So before we get into discussion, I mean, if Corey's
You have to have a
proposing,
motion.
right,
Yeah.
so Corey's proposing, before we got too far down the road, Corey's proposing a motion.
voluntary but strongly recommended for those unvaccinated.
So there's a motion by Mr. Heath, seconded by Mrs. Clark.
I might suggest, because something is coming out of the Department of Health, the board all has a summary that I got from Dr. Karelja, and the administrators do, of there's some testing in there, there's still some other things. Might make some sense to wait to see what that curveball looks like, so we don't have to touch this 100 times. Because we're going to have to come back and do something again anyway, and we may just need to have an emergency meeting. Because I just don't know where that might be. And the testing also may, if it's pool testing, the parents of course have to consent to always. That may also make some of our parents who are, would want it required, feel a little comfortable that there was some testing that was happening. So, I mean, we just don't know what any of that exactly looks like yet. So it's just my suggestion.
So it's better to just hold for right now. You're suggesting just hold rather than keep the plan in place that maybe isn't workable.
Let's see what happens on like tomorrow and what comes out exactly. So the Department of Health convened all of the IU directors, which is really how that's their conduit for getting information out to the school districts. And that's the heads up, basically, that something's coming. So we anticipate that something should be released tomorrow. Hopefully it's not even trailing into next week. And then we're going to have to consider that guidance anyway. And there may be something that comes from that is a little bit more of a compromise that will be palatable to everybody on both sides. We know for certain they're not mandating anything. So that we know for certain. But then if there's anything to revise to that, we could do that then. We just need to make sure we advertise a meeting for 3 days before we have it.
We'd have to do that anyway, though, right? If we were going to. So if we're going to have a meeting regardless because something changes, we could also make the decision to do something tonight that is the default.
Yeah.
And then if we don't have to have a meeting, we don't have to have.
The
a
reason I
meeting at all.
raised the issue is simply because it didn't sound like you thought that the existing plan was really workable.
It's for the middle school.
Right.
For the middle school. It's going to be a challenge, I think, just trying to identify which students are the sixth graders, and then we have to collect vaccination information from the older kids, and, you know.
John does have a point. If something's coming out tomorrow that's going to make us have a meeting again in a couple of days, then it doesn't really matter whether we do something or don't do something
That's the
tonight.
board's decision.
I would
That's
just
the
argue
board's
against,
decision.
I mean,
I
given that we
just
know that more
advise.
information is coming tomorrow, I would argue strongly against taking any further action now, partially because we know something's coming tomorrow, but mostly because I value the opinion of these people, and they did weigh in on the plan that we did not pass. And I would like to give them the opportunity to weigh in on whatever revised plan is going to come before us. It seems to me, to be blunt, quite disrespectful for us to just sort of haphazardly throw together some sort of policy without consulting with the people who are going to have to enforce it.
Well, that's the reason I asked in the first place. Didn't just make the motion.
Which we can still do. We can do both. We can-
Well, the motion is made and we're discussing, right?
But we can always revisit.
Yeah. Oh, it was second, yeah. We can withdraw your motion.
Do you feel like that would be the best thing for you in your position, waiting?
I think that I kind of come back to let's see what the guidance is that's going to come out, because I know we're with a number of people in our community right now that aren't going to be very happy. There might be something in there that is a silver lining, and rather than get everybody all upset and in arms and now filling out e-school applications, because I know that's probably going to happen. It just might be better to do that and come out with, okay, this is what it definitively is. That's just my recommendation.
People aren't filling out e-school applications. They're just not withdrawing from charter school right now. That's what's happening at this moment.
And I can withdraw the motion.
Thank you.
All right. So motion withdrawn. We'll move on to board information under new business.